Good evening. My name is Malik Bush, and I am on my path to become a healthcare worker. I am currently majoring in biology here at Columbus State University. Within recent years, health has become an important topic in our country. The promotion of healthcare and living a healthy lifestyle have both been reinvigorated in our community. While we are refocusing on health in our community, the nation is experiencing its biggest challenge yet. We are currently facing the most significant shortage of healthcare workers ever. The federal government has labeled this a national crisis that demands immediate attention as the number of healthcare workers continues to decline drastically. Hospitals and health systems are being faced with staffing shortages that are jeopardizing the access to care in which they serve their communities. You might ask, why are we experiencing a shortage of healthcare workers? It is because the U.S. has an aging population. More than 50 of the healthcare workers currently working are over the age of 50. We also have an issue with people living longer. Now, this might not seem as a problem to some because we want to continue to increase quality of life, but what it has done is put a tremendous amount of stress on the system. This, along with chronic diseases such as diabetes and mental illness, and the ever-changing healthcare industry, have all contributed to this national crisis. This crisis has occurred decades before and predates the COVID-19 pandemic. However, the infectious disease known as the coronavirus has taken a huge toll on sustaining the workforce. Accelerated by the pandemic, nurses and physicians have both shown symptoms of burnout. Burnout is characterized as high emotional exhaustion, high depersonalization, and low sense of personal accomplishment from work. In other words, Americans have lost confidence in their healthcare professionals, and as a result, these physicians are reporting signs of loneliness, depression, and they are disconnected to the value of their work. On top of this, workers were forced to work extended shifts, which meant being away from their families and had to worry about catching the coronavirus themselves. So what can we do? We need to work as a team and as a community to help alleviate some of the pressures being placed on the people fighting on the front lines every day. Nearly 1 in 5 healthcare workers have quit their jobs during the pandemic. This number right here needs to increase drastically in the coming years. Winston Churchill once said, "Healthy citizens are the greatest asset a country can have." Without strong and resilient healthcare workers, this country cannot exist at all. If our healthcare system breaks down, we break down. These workers need help so that they can continue to help others. Thank you.